For today's video, I wanted to go back to dental assisting videos because a lot of people have been requesting that, and I understand, and I'm happy to make some more for you. I also just kind of wanted to give an introduction because I have gotten more followers. We have over 300 subscribers. Thank you guys. Seriously, I love commenting with y'all. Y'all message me on Instagram. I love it so much, but I kind of wanted to do an introduction again and just say I'm 25 years old. My name is Kirsten, by the way. I live in Southwest Florida. I graduated from dental assisting school in December of last year. I was hired as an orthodontic assistant, and I've been an orthodontic assistant since the end of December in 2018. So yeah, that's just how I wanted to start this video. Luna says hi, and today's video is going to be about the different types of dental assisting. So whether you're in general dentistry, orthodontics, periodontics, endodontics, oral surgery, pediatric, I'm sure I'm missing some. There's so many different types of dental specialties that you can go into that I kind of wanted to tell y'all about them, or at least the ones that I can talk from experience about, because when you're going to school, I think it's really important to know that if maybe general dentistry you feel like isn't for you, there are so many other options and different sort of jobs you can do in the dental office. And that's what I wanted to talk to you about, to just give people some hope that, for me, because I kind of relate to the fact that I didn't feel 100% happy with general dentistry. And there was times during the program and in clinicals and I was like, do I even like this? This doesn't quite suit my personality. I didn't always feel like this was my dream job. But then when I was offered ortho, and now that I've been working in ortho for a little over 2 months, has it been 2 months? Probably exactly 2 months almost. I've never loved a job as much as I love this job. Going to work every day, I don't ever feel discouraged. I don't ever feel like not getting out of bed. I love my job, and that is an amazing feeling. And I know some of my classmates that are in general dentistry and they love their jobs. So just because, one isn't for you, that doesn't mean there aren't a million other options. So I'm gonna sit down and talk to you guys all about the different types of dental assisting, and yeah, I'll talk to you in a little bit. So there's totally a mess behind my bed. I'm sorry, that's my laundry. I honestly haven't felt like doing it, if I'm being honest. Okay guys, so in today's video, like I said, I'm going to talk about the different types of dental specialties. I wrote some stuff down right here about general dentistry and orthodontics, but this is my textbook from school right here, and there's actually a section on dental specialties, so I'm also going to read through that a little bit just to kind of give y'all some insight that maybe I don't have because I haven't worked in some certain specialties before. But I'm just going to go ahead and get started. So I kind of wanted to do like a general dentistry, mainly general dentistry versus ortho, because those are the two that I have experience in. But I think it's important to at least know a little bit about other specialties, because there's something that might, trigger your interest more than the other and could potentially make you a lot happier and want to pursue a job in this profession, even if general dentistry is not right for you. Start with general dentistry. I'm not trying to sound biased by any means, but this is just going to be like my honest opinion of what I think general dentistry is like, and like the certain jobs that you do in general dentistry. So in general dentistry, you can assist with fillings, root canals, crowns, like crown deliveries, crown and bridge, extractions, dentures, partials, implants. It's a very broad spectrum in general dentistry, and that usually depends on your doctor. So different doctors are going to do more of certain things. So, for example, my doctor in clinicals, the private practice doctor, she mostly did crown and bridge and fillings. She didn't really like extractions. She never did root canals. But when I was at my other clinical site, that doctor did like everything. He did, except he didn't do implants or anything like that. He did crowns, fillings, root canals, extractions. So if you're interested in a certain thing, or you like to do a lot of different things, look for doctors, go on their websites and look for what they do and what they offer in their practice. So if you're interested in doing more than just fillings and crowns, then don't work for a doctor that only does fillings and crowns, because you're going to be bored out of your mind. And that's what's kind of cool about general dentistry, is you can find a doctor that does, say they do a lot of extractions or a lot of root canals, and you get a lot of experience in those type of procedures. that experience can lead you into specialties, which usually pay more than general dentistry. So say your doctor does 1 or 2 root canals a day and you're assisting 1 or 2 root canals a day or something like that. That's a lot of experience, and you could then go and apply at an endo office and make $3, $4, $5 more in a specialty. So that's just sorry, I just went off on a tangent. That was a tangent. All right, the next thing is, for me in general dentistry, the procedures were longer than in ortho. So like root canals, this also depends on the doctor. I don't want to say that root canals take an hour and a half when I've seen someone do it in 30 minutes, but they do tend to take longer. Crown preps and stuff like that. Crown preps can take an hour and a half. Like this also depends on your doctor. And I'm the type of person that I get spacey almost. So I found myself during root canals just looking around, kind of daydreaming. And that's when I realized that maybe this wasn't for me. So that's just something to keep in mind. And during root canals, you're just suctioning a lot. That I found in general dentistry anyway, when your doctor does root canals, I just suction a lot and it's very boring to me. And then also crown preps and stuff like that are very boring to me as well. So I kind of knew that wasn't the route that I wanted to go. Also, you have to take a lot of x-rays. In some offices, dental hygienists take x-rays, a lot of the x-rays, and in some offices the assistants take a lot of the x-rays. So you could have to be taking FMXs, panos, cephs, 6 months x-rays, so bite wings and PAs and stuff like that. Just know that if you're in general dentistry, you're probably gonna be taking a lot of x-rays unless your hygienists take a lot of x-rays, which that's actually usually helpful. But I've also been in an office where the hygienist takes no x-rays whatsoever and only the assistants take x-rays. So maybe if you don't like taking x-rays, then ortho, we only take panos and cephs. So those were really simple, and I really like that they're not time consuming like FMXs, even though people take FMXs in 5 minutes, but in school I could not take an FMX in 5 minutes. And if I did, it looked like complete crap. Okay, so also in general dentistry, you're gonna do impressions for custom trays, for dentures, partials. You're gonna do bite registration, and you're gonna use temporary material to make temps. What we would do is take a bite registration, and then we would squirt the temporary material into the tooth that we were going to create a temp out, and then put it back up and pull it out. So that's just part of what you're going to be doing. And a lot of doctors do crowns and crown and bridge because there's a lot of money in that. Crowns are pretty expensive. They're I don't even know, a couple $100s. So doctors really love to get patients in there and get crowns. So you could be making a lot of temps a day. I think at some of the offices they're making 3 or 4 temps a day, but it was a pretty small office with 2 assistants, so that makes sense. But if you don't like making temporaries, then maybe a specialty would definitely be for you, because you're not going to be making a temporary in oral surgery or in periodontics or anything like that. So that's something to keep in mind. I've also found that in general dentistry, you're less independent than in ortho. So in general dentistry, you're mostly there just to assist the doctor. So there's some things that you can do that without the doctor being in the room, usually corona polish or apply fluoride or things like that. But as independent, it's definitely more of y'all are a team, and it seems a lot of times you're waiting for the doctor because you can't do much without him saying something or anything like that. I've also found that general dentistry, and this is just what I've found and I've heard, general dentistry pays less than specialties do pay. And I find this because I feel specialties have to employ less people. And by that I mean in a general dentistry, they also have to pay a hygienist, which you have to pay hygienists a good amount of money. I mean, they have a degree. So in ortho, there is no hygienist. It's just the doctor and the assistant. So I've found and I've heard that specialties do tend to make more money than general dentistry. What I remember from general dentistry, I found that I was more exhausted mentally and physically. I can come home from a day at the ortho office and I feel fine. But while I was in clinicals, I remember just being exhausted, my legs aching, my feet aching, my back aching. I found that it was just a lot more uncomfortable for me. Now I'm gonna go on to orthodontics. So in ortho, I assist with any start, full band, carrier, butterfly, any appliances, any bondings. So those are the only times I really feel like I'm a partner with the doctor. So during putting braces on, putting a carrier on, putting a butterfly on, a habit appliance, anything like that, I help the doctor. Like I pass the bond or the etch, the bond, you know, the cement, whatever, suction, 2x2s. I find that those are us together, but it's a lot more independent. Like he comes and looks at the patient and then he's like, I want these wires, I want a power chain on the upper, I want you to activate lower, I want springs, I want coils. Like he looks for like 2 minutes and then he's gone. Like you're just there and you're just doing everything. And it's really nice because you get to bond with that patient so much. They come every 6 weeks, usually for adjustments. It's just, I find it, I like being independent. I don't want to constantly have to rely on my doctor, and ortho really, I really feel that way about ortho. Okay, so we do impressions for every D-band, lost retainer, and carrier. So every time someone gets their braces off, we take impressions for retainers, usually upper and lower, because that's usually what most people have is upper and lower braces. And then we also take impressions for when patients lose their retainers. And then we take impressions for a lower vacuum form for patients with a carrier, which a carrier, if you don't know, it's basically like the new headgear. So it's just like a much more pleasant experience than having to wear headgear. It's just like they put them on, they like cement, I don't know, it's like a bar, and they like cement them to 2 teeth, and it's supposed to do the same thing that headgear does. Like I said, higher pay. There's no hygienist, so it's just me, 2 other assistants, a doctor, a front desk, and our office manager. Our age group for, I love our age group for ortho. It's teenage to middle school. Mostly there are some adults, and since we're starting to do more Invisalign, we are starting to get more adults. I really love that age group. Another difference is also, I feel like we have more patients. We usually see 50 to 60 patients a day. In general dentistry, we did not see that many patients, but these appointments are a lot quicker. And yeah, I'm gonna talk about my experience of working, or not working, I didn't work there, at my day at an oral surgery office, because I got to shadow at an oral surgery office for school. So I kind of wanted to explain to you what I learned there about what an assistant does there. So the assistants would get there and basically get all the instruments they need to set up for a room. At the office I was at, they did all wisdom teeth, which is like the most common in the morning. And so they had like back to back, like I think they did like 5 or 6 like wisdom teeth removal. And in these rooms, they would have 3 assistants and 1 doctor. So one assistant would hold the patient's head and the arms. So because sometimes when they go under to get their wisdom teeth removed, they like move, especially young men like 15 to 21, they tend to react a little bit more to the anesthesia. So there's someone there like holding the patient's head, holding their arms down if they start going like this. There was also someone that monitored like the heart rate and all the vital signs and stuff like that. And then there was someone who passed instruments to the doctor. That's what they did all morning. So this office was set up where they did all procedures in the morning, and then all afternoon was just consults. Or like if someone had stitches, they would like remove stitches and that, but they were not doing any surgical procedure. Afternoon there was consults. I saw all sorts of things. There was patients coming in, and of course they would have their x-rays up on the screen, whether it was like panos or cephs, and I saw a lot of patients that had like screws and like plates in their face that had been through like traumatic accidents. There was also patients there for oral pathology. So like their general dentist had sent them to oral surgery to get something that they found in their mouth, whether it's like a bump or anything like that, to get biopsied and sent away, and doctors would check and like, you know, look and see if they thought it was actually something to be worried about. I saw a patient that had just had jaw surgery, and she had stitches all behind her ear, and she was getting those removed. So if you're really into like hands-on surgery, like all sorts of different cases, like dealing with like cancer, people that have like mouth cancer, people that need jaw surgery, people that have like need wisdom teeth out, people, it's just people that, you know, have, you know, intense maxillofacial oral surgery. If you like blood, you like action, you like meeting different people, and you like fast paced, go, 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 like, then you will definitely love oral surgery. You know, like cleft palates and stuff like that, so they'll surgically repair those. It's definitely something that if you're interested, you should definitely shadow, because the amount of blood and like noises of like cutting and cracking, I could definitely see how that could really bother someone, like to the point of like passing out or something, because I know people that have passed out during those situations. So I know periodontists, they help patients who have severe periodontal disease. Like if you have like, I would say like slight to moderate periodontal disease, your general dentist will just see you every 3 to 4 months. They might, if you're more on the moderate side, they might recommend you to also go see a periodontist. So you would not only be seeing your general dentist, but you would also be seeing a periodontist. You know, you'd rotate. But if you actually have like moderate to severe periodontal disease, you'll more than likely be seeing a periodontist, and they do like extreme deep cleanings. I don't actually know what an assistant does there. I guess you just assist the doctor. I know they also hire hygienists to do cleanings and stuff like that, but I don't know. I would go to a periodontist and shadow and just see pediatrics. So in pediatrics, it's just obviously, everyone knows what pediatrics is. It's for kids, so it's a dental office just for children, usually until they're 18 years old. From what I've learned that a dental assistant does in pediatrics office, there's a lot of coronal polishing, a lot of sealants, a lot of fluoride varnish placement. You assist the doctor in pulpotomies, stainless steel crowns, fillings. It's a lot of baby teeth. So boom, 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 boom. So you're seeing patient, 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 your coronal polishing, fluoride varnish, and then, you know, all day long. That's what I found, that's like, you're taking x-rays. And if you don't like working with kids, all I'm going to say is if you can't stand children, do not work in a pedo office. You will, you know, sometimes you have to use a papoose board on children where it restrains them because they're freaking out. They, you know, and, you know, if you can't deal with children and then their parents, it's not for everybody. I think it takes a very passionate and a very patient person to work in pediatrics and to actually enjoy it and be fulfilled. That's just my 2 cents. I don't know. I couldn't do it. I love kids, and I love my age group of kids, the middle school to high school, because they're old enough and they're not like 2 and 3 freaking out and don't know what's going on. They usually want to be there because they want to fix their smile. All right. Next, I'm going to talk about endodontics. All I want to say, I don't know much about endodontics. If there's an endo assistant out there and you want to leave basically what you do in a day in a comment down below, that would be really awesome. But personally for me, I find root canals so boring. And I'm not trying to like bash any profession or anything like that, but just for me, I'm a daydreamer. And that's what's good about ortho, is I'm constantly doing something. Like the doctor tells me what to do and then I do it with my own hands until it's done, and then we're on to the next one. Endo, it's like I said, you just suction a lot. But endodontists are much more, they usually have a lot more advanced technology, which probably makes the procedures a lot better. General dentists usually don't invest in such advanced technology because they're only going to usually do simple root canals. If they think that they are not capable of doing a certain root canal, they will refer a patient to an endodontist. And those endodontists have assistants, and those assistants do whatever they need to do. I don't know what an endodontist assistant does, to be honest. And you like love learning about root canals, that's something I would look up. Also, I would shadow at an endodontist. Yeah, endodontists usually, they also say about endodontics, because honestly I don't think that's anything that would ever be good for me. I would probably fall asleep every single day. But I hope you guys enjoyed this video. I hope it was informational. If you have any questions, leave them down below. If I don't know the answer, I will find the answer for you. I think my best tip that I can give you is, if you are interested in something, do research and shadow at the office. General dentistry is not the end all be all. You know, while you're in school, research and try to figure out what interests you the most and what makes you the happiest, and then pursue that. But yeah, I hope you guys like this video, and if you have any other video requests, leave them down below. give this video a like, comment, just so I know that you enjoy this. And I will talk to you guys in my next video.